Today, we will be discussing acromegaly.
A rare hormonal disorder that develops when your pituitary gland produces too much growth hormone.
This extra hormone makes their face, hands, and feet grow very large, and it causes tissues and bones to grow larger.
This disorder is also known as gigantism.
And if you have a non-pituitary or a pituitary tumor, it can lead to gigantism.
Yes, you're correct, Tiffany. There are many symptoms to this disorder as well, including back and joint pain, muscle weakness, and headaches.
In addition, there are also many signs as well, like oily faces, huge internal organs, enlarged lips, nose, and tongue, excessive sweating, and skin odor, deepening in the voice, sleep apnea, impaired vision, and fatigue.
Wow, that's a lot of symptoms. But how can they get diagnosed as a patient with acromegaly?
Well, if the doctor thinks that the patient may have acromegaly, then they will perform blood tests and imaging to look for the GH level in a person's blood and/or tumors in their body.
To stop growth of the tumor, and the doctor can perform surgery. Without a tumor, then you must seek medical therapy, such as somatostatin analogs, GH receptor antagonists, and dopamine agonists.
In addition,
you can also have radiation therapy for people who do not respond well to medications.
no single treatment is effective because it is customized depending on your case of acromegaly.
Yeah, that's right. But where did this mind-boggling disease come from?
Well, most of acromegaly cases are produced by neoplasms of the somatotropic cells of the anterior pituitary. These tumors seem to break out independently of alterations in other hormones and tropic factors.
Interesting. But it was discovered in 1886, right?
Yeah, it was. But I have a question for you now. How can one, such as myself, prevent acromegaly?
Well, typically victims are born with it, but it can also be caused by a tumor.
Yeah, there is no way to prevent acromegaly. But if you detect it early, then you'll have a better chance of being treated.
There's no vaccine either, right?
Yeah, you're correct.
And if founded early, acromegaly is curable.
And even after treatment, the victim will stop growing, but will not shrink. So it is good to find acromegaly early for treatment.
Now watch this interesting video on acromegaly or
Bye.
gigantism, whichever suits your pineapple. Or what do people say? Floats your boat.
Oh, yeah. Okay.
Whatever floats your boat.